fine. Okay, next is calcium. Important element of bone and teeth, also plays a role in cell signaling. Levels of calcium in the blood are very tightly regulated by parathyroid hormone and vitamin D. This is a problem because we can't accurately assess calcium levels by measuring it in the serum because it's so tightly regulated by those other vitamins and hormones. If your calcium intake in the diet is not high enough, calcium is so important, serum calcium level, your body will take it out of your bones to maintain adequate serum levels. And that's why calcium deficiency causes osteopenia and osteoporosis. Now, the RDA for calcium is 1,000 to 1,200 milligrams a day. And we saw on the previous slides that even a nutrient-dense diet may not have enough calcium. 80% of adolescents and 50% of adults don't get enough in their diet. But supplementation with calcium is quite problematic. This has become popular, especially with middle-aged and elderly folks as we get older, to prevent osteoporosis, given calcium's role in bone health. That's understandable. But calcium supplements have been very disappointing in studies. They have not only not been shown to reduce fracture rates, they actually increase them in many studies. Supplemental calcium is also associated with a higher risk of cardiovascular disease. In a 2016 study in Journal of American Heart Association, people with a high intake of dietary calcium had a lower risk of arterial calcification and cardiovascular disease. However, the opposite effect was observed for people with a high intake of supplemental calcium. So this goes back to what the slide Dr. Heck showed, where people with higher levels of dietary C may have been at lower risk, but people then who took vitamin C and other supplements were at higher risk. Supplemental calcium does not have the same impact on the body as dietary calcium. And the thinking is that it's such a large bolus of calcium all at once that it affects the serum level of calcium in a way that dietary calcium does not. Just a few more statistics here. A study of 24,000 men and women between the ages of 34 and 65, published in BMJ in 2012, showed that those who supplemented with calcium had almost 140% higher risk of heart attack than those who got calcium from food. A meta-analysis in BMJ, 12,000 participants, showed that those taking supplemental calcium had 31% higher risk of heart attack, 20% higher risk of stroke, and 9% higher risk of death from all causes. And another analysis in JAMA Internal Medicine, also with 12,000 participants, found that intake of over 1,000 milligrams per day of supplemental calcium increased the risk of death from cardiovascular disease by 20%. I'm sorry, I might be dropping pretty big bombshell right here. I'm sorry we don't have more time to talk about this, but I felt like it's really important for you to know. So I recommend that calcium come from food as much as possible. Sesame seeds top the list, but remember what I said before. Seeds have phytate and oxalic acid sometimes, and that's going to impair the absorption of calcium. So even though, and same with greens. So collard greens is listed above canned salmon with bones, but you're probably going to absorb as much or maybe even more calcium from this than you would from collard greens. That does not mean you shouldn't eat greens and you don't get calcium from greens. You do. But it does mean that if you're exclusively eating these foods, you might not be getting as much calcium as you think you're getting. If bone health is a concern and that's why you're using calcium, you also I recommend, as I said, to get calcium from diet, but you also need to pay attention to vitamin D and K2. As we've discussed, they play a really important role in bone health. K2 makes sure that calcium gets into the bones and stays out of the soft tissues, and vitamin D makes sure that calcium gets absorbed from your gut. So in many cases, it's a better strategy to focus more on K2 and vitamin D, and in addition to getting your calcium from the diet, than it is to take calcium supplements. Weight-bearing exercise, also crucial for bone health as we get older.